Victor, and this is a story about the Cyberknife. The Cyberknife will kill prostate cancer, lung cancer, and breast cancer without harming the body. My prostate cancer was cured by the Cyberknife in 2007. And since going through the Cyberknife, I've been trying to give the Cyberknife as much positive press as I can because the treatment was so easy and painless and did not interrupt my life at all. Now, many primary care physicians are unaware of what the Cyberknife can do, so I've published several videos about the Cyberknife stopping my prostate cancer without surgery. But this video is different because you will see patient stories from different parts of the country about the Cyberknife being used to stop breast cancer, lung cancer, as well as prostate cancer, all without surgery. Now, after the patient stories, you'll have access to a video that will demonstrate how you can find a facility closest to you anywhere in the country. And basically, a summary of the Cyberknife treatment, regardless of what you're being treated for, is the patient arrives at the treatment center for the predetermined number of days based on what's being treated, and that's going to vary from patient to patient. And the patient remains fully dressed during treatments, and you can go home every single day. Now, the first video, the first patient story that you'll see will be from a former Navy pilot. I begin with this video because he directly addresses the abilities to stay completely dressed.
When I would climb into this airplane, I knew that there was no one else better on the earth flying this airplane. I could take on any adversary and be successful. I graduated from Top Gun in 1986.
No, it looks okay, Bing.
And they called me Bing, as it goes along with my name, Bing Crosby. Going twice the speed of sound, pulling 8 or 9 Gs, it's just feelings that are unmatched. Life did come to a stop. You never expect to hear those words in your life. As much as you can prepare for it, you never expect that it's going to be you.
About 1 out of 7 men will be diagnosed with prostate cancer. We have an excellent way to screen for prostate cancer. It's called the PSA blood test, the prostate-specific antigen. We can usually detect prostate cancer when it's still curable.
The VA won't check your PSA unless you, as a patient, ask for it. So I did get a PSA check. Before they recommend a biopsy. When I found out what my current number was last October, 14.6. It's that moment, those lovely 3 words, you've got cancer.
So you can come in here, sir, and just have a seat here and lie back with your head up here?
I took it as almost another mission. Your body is eating itself up. What weapons can you employ to actually take on this enemy that's now inside your body?
We'll start lining up to our target there. You'll feel the table move a little bit.
The most effective weapon was the Cyberknife.
The Cyberknife is the most advanced radiation device for precisely delivering radiation to a specific target in the body. It uses robotic technology to identify where the prostate is, and if there's any motion, it adjusts for it and treats with under a millimeter of accuracy. We do it in just 5 doses over 1 week, and because of that, it's much cheaper than conventional radiation therapy.
You don't even take your clothes off. You lay down on a table, listen to jazz music, walk out and carry on as though nothing had taken place. There's no scars, there's no chemotherapy issues of losing your hair. It was all natural hair loss. So I'm about 7 months out from my treatment. At 6 months, my PSA was at 2.2. I'm ecstatic about it.
Just trying to get a quick photo here before a horse shows up.
I stay in touch with those guys today, and we all still get together and we share stories.
There's all the boys.
Guys get this ego and they want to ignore it all. It's okay, it'll get better. Get them to go do their test. You are not invincible when you're given a diagnosis of cancer.
Okay, the next story is Catherine. Now, Catherine talks about how easy and painless the Cyberknife treatment was for her breast cancer. And she also mentions that she almost fell asleep during her treatment. And coincidentally, I almost fell asleep during my second day of treatment for my prostate cancer because I was so comfortable after the first day. The first day you really don't know what to expect.
Went to my doctor and he told me we have a choice of a lumpectomy or a mastectomy. And I said, I want a lumpectomy. We did that. He said, you're not going to need chemo. You're going to definitely need radiation. He says, I want to show you something. There's this thing called Cyberknife. Came into this office, Cyberknife, very pleasant, explained everything. The first time I did it, I was really nervous because, of course, I'm looking at this big machine. I'm saying, is he going to eat me alive or what? First time was fine. Second time I came in, I knew this machine. We were buddies. I fell asleep. And the other sessions, I fell asleep the whole time. It was easy peasy. I go to the reception, pleasant, courteous, answer any questions. They just did a great job. Everybody was so good to me. I couldn't ask for better. I didn't feel it. There's no side effects. Quick and easy and pain-free. They told me I was cancer-free, and I was happy I'm cancer-free.
Okay, the next video is Judith. She went through several weeks of chemotherapy and radiation for her lung cancer, which all required a hospital stay. And later, after that, she had a recurrence, and her doctor then recommended the Cyberknife, where she talks about her experience.
My name is Judith. Spot on an X-ray that turned out to be a mass on a CAT scan that turned out to be stage 3 lung cancer. So I did 12 rounds of chemo, 23 days of radiation. And about a 2-week break, went into the hospital. I had my upper right lobe removed. My lung didn't seal, so I spent 15 days in the hospital. Once I got home, I spent four more weeks at home before I could actually go out and physically work again. So they did find a fragment of a live cell. I went back and did 8 more weeks, which was 8 more rounds of chemo. For almost 2.5 years, everything was clear, the CAT scans were clear, and then we started to have this node that lit up, and we kind of watched it for a while, and it was growing and it was intensifying, so we decided we needed to do something. My thoracic surgeon suggested Cyberknife rather than go in and go through that invasive whole procedure all over again. But during the treatments, I mean, basically I was in the room by myself on the table. It was a large room, so it wasn't a claustrophobic experience at all. And they had a video on the ceiling, like a TV, and so they played Animal Channel, because obviously you can't laugh and you don't want to cry because you don't want to do a lot of movement, but breathing normally, and the machine would work with me. You know, I mean, it was actually, I thought of him as like this little dinosaur kind of little guy, because he was all over you, around you, sideways. You just kind of lay there. The worst part was something itched. You couldn't itch it. So, when people say to me, you had Cyberknife, what was that like? It's, well, it was a piece of cake compared to what I had been through already. I mean, you have to think, okay, do you want to go through chemo, radiation, chemo, surgery, chemo, or do you want to have 4 treatments in 3 hours on the Cyberknife? To me, it was a no-brainer. Yeah, the quality of life after the 4 treatments, I mean, there was absolutely no side effects. Nothing changed. I was able to get up off the table, go out into my daily life, go back to work. There was no downtime like there is with surgery. When I was in the hospital for 15 days, there was a lot of downtime, and then 4 weeks recouping at home. With the Cyberknife, there was absolutely none. One of the things that when people say it's terminal, they hate that. I hate when people say that because they're not God. And technically, I shouldn't be sitting here with you now 5 years later either. Well, I really struggled with how to tell and who to tell. We started telling friends, and unfortunately with lung cancer, a lot of people just think of it as pretty much a death sentence. my closest friends, I think, reacted the worst. They're afraid to lose you. So I think they're the ones that react the worst. And with my son, I basically answered his questions. And he didn't really want to know a lot, so I didn't tell him a lot. And it wasn't until after everything was said and done, and I had my first clean scan, that we were driving in the car, and I told him that my scan was clean. And he goes, so that means you're not going to die? I took my breath away. I couldn't even for a minute, because I thought, I never thought I was going to die. Like, for me, it wasn't an option, I never thought I was going to die. And it was amazing how many people just kind of thought, well, she's going to die. And he was one of them. I was a former smoker. But I had quit, so even when the spot showed up on the x-ray, because I was exposed to tuberculosis as a child, I just assumed it was tuberculosis, and finally had, reared its head. So when I had the CAT scan, they let me go home. I knew it wasn't tuberculosis, but I still didn't think it was lung cancer, because I think that you would know if you had lung cancer. I would have felt something. I would have been coughing. You would have some symptoms, and there was nothing. So many people being diagnosed today are former or never smokers, and people that are dying today from lung cancer never smoked a cigarette in their life. But I think, because I'm 5 years now, for me, this is the first question a stranger will say to me. Well, you were a smoker, right? Because I think people are scared of lung cancer, and it's the way that they react. Well, okay, you smoke, so if you smoke, then I won't get it. And it's not the way it is anymore. 60% of the people being diagnosed today are former or never smokers. And a large part of those are younger women. So.
Okay, in this next video, Jean and her husband talk about her experience with the Cyberknife in treating her lung cancer.
I was diagnosed with lung cancer. It was quite accidental that they discovered it. So I had the treatment by Cyberknife. And it's all gone now.
Can I inject something? Because in some cases I was on the outside looking in, and the one thing that I remember was that she had 4 treatments. They lasted about 30 minutes. There was no pain. I questioned her on it. She said she felt nothing. There was no pain. 30 minutes. We got in the car, went home, and we did that 4 times. And on the last CAT scan, it showed that everything was fine. So that's quite a success story. I would consider it a success story, not just because of age, but for anybody to have lung cancer and have 4 simple treatments of 30 minutes each and be able to have a follow-up that says you're okay. She feels good, she eats good, and I don't know what more we could ask for. The opinion that we got from the doctor was that surgery was not an option because of her age, that there would be a there would be a lot of risk involved if surgery was involved at her age, and they definitely were pretty negative on surgery.
I'm not that old, I'm only 21.
So she'll be 92 in April.
Oh.
92, so you're young. When you're 99, you look back on.
Yeah.
I'm in the same bracket. I'll be 92 in April also. And we've been married for a little over 70 years. So everything is big numbers with us. I don't think we've sacrificed anything. I think, if anything, we have gained, because the cancer that she had must have been what contributed to the lack of energy and the cough and the different things that she had, which are non-existent now. And she also smiles once in a while, don't she? She eats well, sleeps well, we enjoy ourselves, we take trips, we do everything that we would want to do. So I would say that nothing has changed after the treatment, and we're back to where we were before it all started. When she was discovered to have the spot on her lung, at that time she was having problems. But as of right now, the only problem we have really is waiting for the weather to get nice so we can get in the car and go someplace. Do you agree? See, she agrees. That must be right. We're not promoting anything. We're acknowledging the fact that we had found a wonderful way to treat her. And the only sad part is that in talking to people, not as many people are aware of what is possible. In the case of lung cancer, the only thing we have experience with, and that's sad. So we try to bring this story up to as many people as we can. And the local paper has helped us a little, and we're going to continue to do it. It's a wonderful thing not to have surgery, not to have pain, not to have lose your hair, or it's easier than going in and having your picture taken because you're in a new environment. You have a big robot staring down at you, and you can tell your friends about what happened. So it has a lot of good sides to it. And as you can see, she's in good shape now. She eats good. She's happy. In all of the years, there's been quite a few of them that we've gone to hospitals, met with doctors or anything, I never have found a group of people, 100%, that were as gracious and as kind and as good in the things that they did for both of us as we found at El Camino Hospital. I can't praise El Camino, the staff, or the doctors. It's impossible to convey my feelings towards those people. It's that good. I also would like to mention the fact that Dr. Sinha, who was our relation with the Cyberknife and with the hospital, was fantastic in explaining what happened, what the results were, what the risks were, anything. If I had a question, he answered it in detail. He was fantastic. I appreciate every minute that I spent with him. He was, because I wanted to know what was going on, and certainly my wife was a little vague in answering some of my questions, but he wasn't. It was a wonderful experience. If you had to have this experience, I'd say have it with Dr. Sinha and Cyberknife.
I am very grateful that there was Cyberknife to have. A couple of years ago, we didn't even hear about it, but it's marvelous, and there's no pain and no difficulty in having it. You just have to lie very still and have it happen. There was 3 or 4 times I had it, but then it's all over. And it's almost unbelievable that little, to lie there still and have this thing go around you, and it cures it. It's amazing.
Now, this last video is how to find a Cyberknife nearest you. Click on the link below this video for access to the demonstration on how to find a Cyberknife, no matter where you are in the country. If you click on that link, that video will demonstrate how to get started. Basically, you just type in, you're going to end up typing the name of go to the associated website that's demonstrated in the link, and you'll end up typing the name of your city. And it will tell you the closest Cyberknife within 200 or 300 or 400 miles. However far you're willing to search. Thank you for watching. Good luck to you. Right below this video, there's a link that will enable you to have access to see a demonstration of exactly how to find a Cyberknife facility near you, wherever you are in the continental United States. One common theme in all these stories is the painless treatment of their problem with a lack of interruption to their lives, and it works. One other note, in 2007, my family doctor referred me to a surgeon who did a biopsy. After I did some research and found out about the Cyberknife, I could tell he had did some light reading about it, but he could not answer my questions in good enough detail about the Cyberknife to satisfy my curiosity. So I found the nearest Cyberknife, and as it turned out, there was one that was only 20 miles away from me. And I stopped for treatment on my way to work for 5 consecutive days. It took 45 minutes each day. So basically, I had to go to work. I had to get up earlier every day to go to work, 45 minutes earlier. And once again, if you click on the link below, this will give you access to the video to demonstrate exactly how to find a Cyberknife facility nearest you. And you're going to be looking for the Cyberknife facility based on your city name or your zip code. And by following the examples in the demonstration, you can find a facility closest to you. Just click on the link below. If you should have, or you know someone that may have a need for cancer, for lung cancer or prostate cancer or breast cancer treatment, and they don't want to be hospitalized for weeks or days or months, keep this information available, because you'll be able to find a Cyberknife. It's good reference material for future use if you don't need it immediately. It's good to be prepared, because the longer we live, the higher the chances are that we may know someone that needs something like the Cyberknife. The Cyberknife basically is now the future. The future is here. It's almost like Star Trek. You just lay down and completely dressed, no cutting, no scalpel involved, and you're treated. And when you're done, when I was done, the doctors told me, okay, we're finished, you can get up now. And I was like, huh, that's it? And that was it. And it got to the point, actually during my treatment, it got to the point that at one time I told after the halfway point of my treatment, I told my wife, I don't think it's having any effect. And she says, why? I said, because I should be feeling something. I'm not feeling anything different. And I was looking for a strange feeling, for something to be feeling funny. And nothing felt different in my internals at all. My function, all of my male functionality remained intact. And I was totally surprised at that. In other words, it didn't interrupt the intimate lives between my wife and I. And had I not told her that I was going through Cyberknife treatment for prostate cancer, she would not have known it. And once again, there's a link below this video for access to a video that will show you how to find a Cyberknife closest to your city. And by following the examples in the demonstration, you can find a Cyberknife facility that is closest to you. So click the link below.